Welcome back to Voices of Long COVID. I'm your host, Noelle. This season, I've been bringing you strategies and support for living with our condition and discussing current themes around the topic of long COVID. I hope you're finding it useful. On today's episode, we're exploring a topic that's become increasingly central to the long COVID conversation, POTS, or Postural Orthostatic Tachycardia Syndrome. And to do that, I'm pleased to welcome Trineta Bhojwani. Welcome.
Hi, thank you so much for having me.
Trineta is a neurophysiotherapist based in Vancouver who has a special interest in supporting those living with complex chronic conditions. She leads programs for POTS, Ehlers-Danlos syndrome, ME/CFS, post-concussion syndrome, and complex pain syndromes at the Canadian Pain and Regenerative Institute. She has done extensive additional training in supporting these conditions, and attending the Dysautonomia International Conference in 2023 inspired her to develop programs for these highly underserved conditions. She is also a certified practitioner with the Ehlers-Danlos Society. Trineta, what is POTS and how does it fit under the dysautonomia umbrella?
Thanks for such a wonderful introduction. That was so kind of you. Yes, so let's first understand what is dysautonomia and POTS. So dysautonomia is essentially a dysfunction or an imbalance in our autonomic nervous system. So the autonomic nervous system is that part of our nervous system which controls all the automatic functions of the body. So your heart rate, temperature regulation, your digestion, blood flow, all of these things are automatic functions that we don't control on our own. And they're sort of led by the autonomic nervous system. So when there is an imbalance in this system, it can lead to different conditions because it controls so many different systems. And one of the most common type of condition we see is postural orthostatic tachycardia syndrome, which is POTS. So essentially, dysautonomia is this umbrella term for any condition that can come from an imbalance in the system. And one of the most common types of that is POTS. So now let's understand what is POTS and what's actually happening in our body with POTS. And I like to do that with the water bottle example.
Okay.
So if we were to take a water bottle and it was half filled with water, if it was half filled with water and I kept it upright, the water would pool to the bottom of the bottle and not enough water would reach the cap, which is the top part of the bottle. Now, if I take this same water bottle and keep it horizontal, the water will now evenly distribute through the whole water bottle.
Interesting.
Right? That is essentially what's happening in the human body when an individual is living with POTS. So when they stand up, the blood pools in the legs and the abdomen, and not enough blood reaches the brain. Our brain needs a lot of blood to be able to do its function because it gets oxygen, glucose, it's fuel from the blood. So when the brain isn't getting enough blood flow, the heart starts to race because it's like, oh my God, the brain isn't getting enough blood, not getting enough oxygen. We need to sort of compensate for that. So that is why we see the tachycardia component. But essentially, the foundation of POTS is that there is lack of cerebral blood flow or blood flow to the brain. And when that individual lies down, the blood starts to distribute more evenly, the brain starts to get more blood, which is why some of the symptoms can go down when they lie down. So that difference between lying down to standing is called orthostatic intolerance or difficulty with being upright because of the blood flow being impacted. I hope that makes sense.
Yeah, I love that water bottle analogy. That really makes it visual. Yeah.
Absolutely.
Have you seen a significant increase in POTS diagnoses since the pandemic began?
Yes, there's definitely been a notable rise. Now, virally induced POTS was always known. We've known that, virus is a big trigger for POTS, but post-COVID-19 specifically, there has been a huge ramp up in POTS diagnoses. Now, there are two layers to this, and this could be my bias, but one aspect is, of course, the COVID-19 virus through certain mechanisms has a huge impact on the autonomic nervous system, which leads to POTS. But the other is also the awareness piece. I feel like post COVID, these symptoms are being recognized more. Uh, Providers are asking the right questions and also getting tests like the sit to stand test, the lying down to stand test, or the tilt table test conducted. So I feel like POTS was always silently affecting people, but COVID turned the volume up and put it in the spotlight, and now we're recognizing it more. So I do think there are two factors. One is the actual impact on the autonomic system, but the awareness piece, and this could be again my bias, is I think a big one as well.
Absolutely. You explained a bit of this, but why do so many long COVID sufferers develop POTS? How does the autonomic nervous system become dysregulated in these patients? Do we understand that mechanism yet?
So I would say we're still learning. There's a lot of research that's emerging in this area even now. But there are some very strong mechanisms that have been suggested. So one is the autoimmune response. So it is proposed that the virus exaggerates the immune system response, and the immune system produces antibodies against the autonomic nervous system, wherein it disrupts the signaling within that system. So one is the autoimmune aspect of the virus. The other is that the spiky protein, which is on the COVID-19 virus, itself can damage certain tissues. So it can damage the nerves that regulate the blood flow, which is what we also call small nerve fiber neuropathy. It can damage the lining of the blood vessels and impact circulation because the blood vessels are now impacted. And it can also cause neuroinflammation in the brain where we have some autonomic centers. So there are different theories proposed, but there's definitely a strong correlation between how the virus impacts, there's a strong correlation of the virus impacting the autonomic nervous system.
Are there unique symptom patterns in long COVID related POTS compared to idiopathic or other forms of POTS?
Yeah, that's a great question. And to be honest, this was something I was seeing a lot early on when I have been seeing POTS patients before COVID. So post COVID, I definitely saw a difference. And now literature is also suggesting it. So what is said is like what we're seeing is that there are those classic POTS symptoms, but in certain areas, we're seeing a more exaggerated and heightened impact. For example, cognition is a big one. So I'm very commonly seeing more cognitive challenges, brain fog, difficulty finding words, processing things. Fatigue and post-exertional malaise is huge in this group, which is why we have to be really careful about how we're planning rehab. And also certain lingering respiratory issues like shortness of breath, difficulty breathing, air hunger. Now, these are symptoms that even individuals with POTS not associated with COVID-19 do have, but I've seen a huger, more intense impact in the long COVID group.
Trinetta, how is POTS diagnosed?
Okay, so there are some diagnostic criteria. We have good established criteria. One is that we want to see a change in heart rate from lying down to standing. So we measure the heart rate when the individual is lying down, and then we measure the heart rate when they're standing up over a 10-minute period. Now, I emphasize the 10-minute period because a lot of times patients will come to me saying that their doctor did the lying down and standing up test and they ruled out POTS. And more often, they haven't done the full 10 minutes, which is important. So we want to see how that heart rate changes over 10 minutes. And if there is an increase of at least 30 beats per minute, then it is suggestive of POTS. Another aspect is that there should not be a drop in blood pressure. This is another common misconception that POTS is increase in heart rate and drop in blood pressure. We actually don't see a drop in blood pressure. So that's what the diagnostic criteria suggests. Second is, as I said, symptoms of orthostatic intolerance. So symptoms that heighten when an individual is upright and relieve when they lie down. And this should be there for at least 6 months. And the third is that we want to rule out other causes of tachycardia because tachycardia can be caused by other things, hyperthyroidism, maybe anemia. So we want to rule those things out with blood work and other tests, and also maybe do a comprehensive heart testing before we go on to the diagnosis of POTS. So these are like broadly the three criteria. Now, when it comes to the lying down to standing test, the gold standard is the tilt table test, but that has to be done in a controlled setting. So it's only done in specific cardiology clinics, a lab, or maybe the hospital. The active 10-minute stand test actually has very good evidence in literature. So that's a more easy to do test. Like you can do it at home, you can do it, at a clinic, you can even do it with your physio, like me. So that test is more accessible. It can miss 30% of the cases though. So we want to be mindful about that. So the way I do it is if I am seeing the clinical picture match bots, I will do the active stand test and then send the results to the family doctor for further testing. If we don't see an increase in the 30 beats per minute with the active stand test, but I'm still seeing the clinical picture to match POTS, then I will recommend to the provider that can we consider a tilt table test because this might be getting missed in the 10-minute test. So gold standard is tilt table, but you can very much just do the active stand test. And if it is negative, but there are still symptoms, then we need to explore that further.
So are you referring to the NASA lean test? Is that the same as the active stand test?
The no, so the NASA
No.
lean test used to be done before. There's actually a lot of confusion around this. A lot of people call the active 10-minute stand test the NASA lean test.
Okay.
So there's a lot of confusion with these. They're used interchangeably. But the new terminology is actually the 10-minute active stand test. So we don't do the head down or leaning against the wall and all of that anymore.
Okay. Yeah. And what you were saying about doctors missing it in their clinic, I mean, most doctors' appointments are 10 minutes in total, right? So they're probably not doing the 10-minute check, right?
Absolutely, which is why sometimes we have to advocate for ourselves and doing the test at home and then showing the doctors the results or doing it with another provider who is able to give you more time and then taking it to the doctor can really help. Sometimes we have to wear the detective hats on our own.
Absolutely. What are the most common symptoms of POTS, understanding that there are different types of it?
Right. So as I said, POTS is reduced blood supply to the brain, and that can manifest in many different ways. So there's a whole spectrum of symptoms that one can have. The most common ones I see are dizziness, lightheadedness, nausea, brain fog, cognitive challenges on being upright, the feeling of fainting, but not necessarily fainting. And again, a common misconception is that if you don't faint, you don't have POTS, which is not true. Most individuals with POTS feel like they're going to faint, but they don't faint. So those are some common symptoms. Now, when it comes to the subtyping, there are three types of POTS that have been recognized. One is the hypovolemic POTS, in which we have low blood volume. Then there's neuropathic POTS, in which the nerve fibers that regulate blood flow are impacted. And the third is hypoadrogenic POTS, where there is an increase in the stress hormone norepinephrine in the body. Now, what I would say though is that current literature is moving away from this subtyping because it has been seen that usually an individual has characteristics of all three, how much of which varies from individual to individual, but very rarely will we see only one type of POTS in an individual. So now the recommendations are to move away from this subtyping and to really treat based off symptoms and how the individual is responding to different strategies, and then plan that treatment accordingly.
That makes sense. I definitely don't fit into one strict category, but yeah, I have a lot of the symptoms.
I have actually not seen any patient fit into one strict category in so many years of practicing this.
Interesting. Can you talk about the range in severity and symptoms? Do some people experience mild cases, or is it typically disabling for everyone?
I'm glad you asked this because it's important to recognize that, like any chronic illness, POTS is also a spectrum in how it presents. Yes, some individuals have milder symptoms, or some people have better recovery timelines, and are able to manage their day to day with very few tools. While for some, it is more disabling, especially early on, and when they're in a flare up. So there is a whole spectrum. I get very commonly asked that, I've seen so and so recover, can I recover? And what I would say would be that recovery is not always possible. In fact, in most people, very honestly, not possible. But you can manage and improve your quality of life with various different tools, no matter where your starting point is. So that is the bigger picture here. Now, POTS rarely comes alone. I think there are always some comorbidities associated, and that does complicate the presentation. So Ehlers-Danlos syndrome, mast cell activation, ME/CFS, maybe if you've had POTS post a concussion, then concussion symptoms, all these things can layer on and complicate an individual's presentation, which is why the care needs to be individualized. But I'm a strong believer that no matter where your starting point is and no matter how your journey is, with the right tools, we can definitely improve quality of life.
I definitely feel like there's a lot of overlap, and it's hard to know what is long COVID, what is MECFS, what is POTS. And I started off mild, and I heard a lot of people talking about POTS, and I thought I don't have that. I would have water with noon every day and feel fine.
Mm,
And then it became quite severe quite suddenly when my MECFS became severe. So there's
right.
definitely a lot of overlap.
Overlap and a lot of common pathomechanisms as well, which so when one gets worse, the other also gets triggered. And which is why, again, as I said, the tools need to account for the whole picture. Just treating parts with ignoring everything else is often not going to go a long way.
We need your help to spread the word about long COVID. Please share this podcast with somebody new and continue to share your stories with the people around you. What role does the autonomic nervous system play, and how does neurophysiotherapy address the dysfunction there?
I'm so happy that you asked this. um, so the autonomic nervous system is huge because POTS is a type of dysautonomia wherein there is an imbalance in this autonomic nervous system. Now, when it comes to neurophysiotherapy or even physiotherapy for chronic illnesses, it is so much beyond exercise. And I really want to start with that because so many people are getting sick with exercise and have fatigue, and they're like, how is a physio going to help me? But there are so many different things in our toolbox that we can use to improve quality of life that could look like nervous system regulation, breath work, helping patients learn how to pace, how to adapt their daily life in a way that it conserves their energy and does not trigger their symptoms. Education is so, so big. Understanding what is happening, why it's happening, how we can navigate it, how we can manage flare ups. So it looks very different from traditional physiotherapy, where you're going once or twice a week and doing exercises or getting some manual therapy and leaving. I'm not saying that that's not helpful, those can be helpful in other ways. But when we're looking at a chronic illness, we want to develop a roadmap for something more long term. And I always say this to patients is that don't see this as in 6 weeks, I'm going to try it and see if it helps me. This is a long-term partnership where we're doing check-ins maybe every 3 weeks, every 4 weeks, and sort of adding more tools, layering more tools to help you live with this condition better.
Yeah, you definitely integrate a lot of those nervous system regulation techniques like breathing and vagal tone exercises into your work, which is fantastic.
Great.
What are some tips for managing the symptoms of POTS in our daily lives outside of medication?
Oh my God, I could talk for hours on this topic. There is so much. I mean, I would start by saying that POTS is largely managed with non-pharmacological means. Um, I not to say medication is not helpful, super helpful, very important, but how we build our daily routine with different tools is also medicine when we're managing POTS. So to start with the big five, sodium and hydration is a big one because when we're like able to increase the blood volume, that's going to increase the blood flow to the brain. Compression garments and sort of figuring out which is the right compression for you. Literature puts a lot of emphasis on abdominal compression and thigh compression, but if an individual has sensitivities, we may need to pivot around that. Developing a good morning routine because mornings are so hard for an individual with POTS. And really looking at slowly starting with some gentle movements in bed and then coming very, very slowly into an upright position, having your sodium and water on waking up, using compression garments on waking up, things like that, and can make mornings more tolerable. And also modifying what you're doing in the mornings to consume so that it's less energy exhaustive on you. The head tilt, so elevating the head of the bed by 4 to 6 inches, such that the whole body is at a bit of an incline, can actually help mornings because it prevents fluid loss through the night. So yeah, things like that, counter maneuvers, gentle movements that keep the blood moving and circulating through the body, looking at how to adapt positions so that we're keeping it more POTS friendly, avoiding triggers, like as I said, I can talk for hours on this topic, but non-pharmacological ways of managing POTS are super, super important and often not talked about enough, especially in doctor's appointments. So, learning this on your own or with a provider who understands can be impactful.
Yeah, a tip that you gave me a couple of years ago has been so helpful, and that is to keep my body cool, especially in the summer.
Right.
Um, so I have a few portable fans, like a neck fan and a fan that clips on to my shirt. I'm always keeping them charged. So I have one that I can grab at any time. And I have one in my purse, in my car. And that's been so helpful because once my core body temperature gets
Mm,
raised, it's so hard to bring it back down again.
yeah.
So being proactive in keeping your body temperature down, that's been really helpful.
Absolutely, because heat is a trigger for the autonomic nervous system. So we want to be mindful about that. Just the other day, I was having a session with someone and she raised her arm, just like I think she didn't realize, but she raised her arm a little bit. And then she's like, I'm getting dizzy. I don't know why I'm getting dizzy. And I was like, because with POTS, a known trigger is elevating your arms above 90 degrees. So then we went into modifying activities in her daily life that can prevent that or manage that better so she doesn't have that flare up. And she didn't realize she was having a flare up due to that. So things like that are so important to be mindful of.
Yeah, and I find I have to be really strategic with outings.
Yeah.
So I have to think, what time of day do I go to the bank? Is there going to
Hmm.
be a lineup that time of day? Do I need to bring a cane with me? Are there stairs where I'm going? And that's been really helpful to, again, be proactive and think about being intentional with your outings so that you're not standing for an extended period of time, which is a huge trigger as well.
Absolutely. 100% agreed. I'm so happy to hear that you're doing that because those are all little strategies that help us regulate our system better. And if you do have to stand for too long, do some gentle counter maneuvers that can help with the blood flow. So things like that, yes, really, really important. Non-pharmacological management of POTS, in my personal bias, is as important.
How do lifestyle changes like nutrition and hydration and salt intake fit into POTS management?
They're very huge. Now, if we're talking about hydration, let's come back to that water bottle example. So that water bottle is half filled, so the water accumulates at the bottom. But if we fill that bottle up to the full, obviously more blood is going to reach the cap. So if we increase our blood volume, more blood will reach our brain. Now, when it comes to hydration, what I do want to say is that the balance of sodium and water is important. I often see patients having a lot of water in which case they're only really peeing it out, or they're having too much sodium, which can sometimes impact your gut. And neither increase blood volume independently. They need to come at the right ratio together to enhance the blood volume. So, what I would say would be for every liter of water, one must have at least 500 milligrams of sodium. And you can build this up to 1,000 milligrams of sodium per liter, but at least 500 to 1 liter of water to ensure that we're actually increasing the blood volume. Coming to nutrition, couple of things here. Large meals and high carb meals can lead to POTS flare up or crashes. Reason being that with large meals, there is increased pooling of blood in the abdomen, which takes away even more blood from our brain. So that is why small, frequent meals through the day is important over having large meals. Even the position in which you have your meals and what you do after a meal can be important to prevent those crashes. The second piece is that when we have high carb meals, it can cause a blood sugar crash. We see something called reactive hypoglycemia, which can also lead to a flare up of symptoms. So, having more well balanced meals, a good ratio of protein, fiber, low carb options can be helpful. I'm definitely not a nutritionist, so I will give some general recommendations usually. But if we're consistently seeing this to be a challenge, then I do recommend to a nutritionist. MCAS is another thing that can cause a lot of sensitivities with food. So if I see that, I do encourage my patients to work with a nutritionist.
I have hypoglycemia. I've always had that, which is low blood sugar. Do you know of any relationship between blood sugar levels and POTS?
Yes, I have seen this quite often and actually was reading some literature on it very recently because I got curious seeing this so often in my practice. Now, let's understand this. Low blood sugar symptoms can look very similar to POTS symptoms. So, low blood sugar symptoms are sweating, lightheadedness, dizziness, which we know are also POTS symptoms. So, when an individual has both, it can mimic each other. And number one is to understand whether this is low blood sugar or this is POTS. Another layer is that low blood sugar can actually trigger a POTS flare up. Why that happens is because low blood sugar activates our sympathetic nervous system because it's, in a sense, your system wanting to protect you. So we know that with POTS, that sympathetic nervous system or that fight or flight state is already heightened. So when something like low blood sugar further triggers it, it can lead to a POTS flare up. Second caveat is that our brain needs glucose to be able to do all its functions. With reduced blood flow, it's already getting less glucose. And now with low blood sugar, it further impacts the energy reserves of the brain. So that can also trigger a POTS flare up. So what I do is if we're seeing a correlation between this, I encourage patients to get a continuous glucose monitor and see if their POTS flare-ups have any association with low blood sugar. And if it does, then we look at different strategies like balancing meals, adding in a light snack to be able to manage the sugar levels. Or I refer back to the doctor that, hey, this is happening. Do we need to look at medications? Could any medication be potentially triggering this? So we have to sort of brainstorm and understand what's causing that. But there is definitely that relation. But one other piece I wanted to add was the reactive hypoglycemia, which I mentioned earlier. So when we often have large high carb meals, it leads to a sudden increase in sugar or glucose. And that causes excessive insulin to be released to be able to combat that glucose spike. Sometimes that insulin is too much and can actually lead to the blood sugar to drop. So that can also cause something called reactive hypoglycemia, which is not something uncommon in those with an autonomic dysfunction because their autonomic system is impacted. So we want to have more well-balanced meals. We want to look at the carb ratio in our meals to sort of navigate that. PCOD, MCAS, all those things can also impact this, cause instability in the blood sugar. So those pieces need to be stabilized if we want to prevent these episodes.
So interesting. Yeah, because I'm lying down so much, I went through a period of time where I was eating less. it's
Hmm.
hard to eat when you're lying down. So,
Right, right.
yeah, I was definitely noticing that I would have like a low blood sugar type of crash, which would very quickly turn into a crash, like MECFS crash. So I have to keep on top of my nutrition and eating for sure.
Absolutely. And which is also why sometimes with so many electrolytes, we also see sugar in them. Like the WHO recipe also has sugar in it, is because that is also an important piece. I mean, sugar is important for many reasons. It helps with increase of blood volume, but those electrolytes or more liquid forms of managing the blood sugar could maybe be helpful in that case.
Mm-hmm. Let's talk about movement. How important is movement with this condition? Knowing that for those of us who have MECFS on top of it, this only complicates the matter.
Wonderful question. I mean, I get this almost every day in my practice because I see so many patients with both POTS and MECFS. And I have to say, even initially, it took me time to sort of understand the right way to approach this as well. Now, I'm going to try my best to break this down and help the listeners be able to actually apply, tools from here. First, let's understand why exercise helps POTS. One is the muscle pumping action with movement promotes blood circulation, so it helps more blood reach the brain. Second is with consistent exercise, the muscle tone increases. So it almost acts like you are wearing a compression garment all the time. You have like this inner compression garment that's helping with blood flow. And it also improves with stroke volume. So how much blood your heart is able to emit. So that is why exercise helps spots. But with ME/CFS, we know that the energy system is impaired. So if an individual is pushed too hard or pushed too strong, such that they go beyond their anaerobic threshold during exercise, that can lead to a huge flare up. We see post exertional malaise, and over time, that actually leads to decline in health. So we have to be really, really mindful of this. So it's like two conditions that come together but are very contradictory. Exercise helps one, and exercise makes the other worse. So, how do we start? Now, my thoughts and my approach here, and what's worked for most of my patients, is number one, exercise is not the first line of management. We first have to start by stabilizing the system better through all the other tools that we've also discussed so far. So, different lifestyle strategies for POTS, regulating the nervous system with breath work, developing a sensory diet where we use sensory tools to calm the nervous system down. We can also look at pacing and fatigue management strategies, making sleep better. So, through different tools, both on the rehab side and with medications, we want to first try to stabilize our system. Now, when I say stabilize the system, I don't mean symptom free. I mean coming out of that boom bust cycle and having a more consistent presentation. Once we've reached that point, we could look at adding exercise. And again, exercise is not traditional, go as hard as you can, get your heart rate up, no pain, no gain. Those are not helpful ways to look at exercise. They're very harmful, in fact. Exercise could look like being in bed and doing simple ankle toe movements. It could look like doing some simple marches and maybe just 3 repetitions of it and really starting there. I always say this that it should feel like nothing. It should feel like you're not doing anything. And then we know that we're doing the right thing. To give you an example, one of my patients, she'd come to me 2 years back and she had MECFS for a decade. Post COVID-19, she developed POTS and had a huge, huge flare up in her symptoms. Her MECFS significantly deteriorated. POTS was, at its peak, was very debilitating symptoms for almost a year and a half before she saw me. So the first 5 months, there was no exercise in the treatment plan. We were really just developing small, small tools every week to be able to stabilize the system better. And I remember after 5 months, the first time I added exercise, I added 3 exercises for like 4 repetitions and in a dark room. I was like, let's just start here. And now 2 years later, she's actually able to go for 30-minute walks and still be within her anaerobic threshold. So your capacity to do more within your anaerobic threshold can improve. I would be careful on saying that it's not true for everyone, but for a lot of patients, I have seen that to do more within that window can improve, but it's super slow, very low, really should feel like nothing.
Mm-hmm.
Having said all of this, I do want to acknowledge that some individuals have very severe ME/CFS, and this may not be their reality. Exercise or movement in this form may just not be the goal. And using spoons for physical tasks could look like being able to engage in ADLs, being able to sit up and have a meal, being able to dress. So we have to sort of navigate those things. Like, I wouldn't want to take away spoons from things that are meaningful to the individual for exercise, right? So it looks different for everyone. It's very, very individualized. There are really no protocols here. We have to curate the program to where the person is and meet them where they're at.
Mm-hmm. Can you talk about the Utah ADAPT protocol?
Right. So this is a protocol that very recently came out for those with POTS, and I think it's a very, very valuable protocol. Earlier, we would have protocols like CHOP and the Levine protocol, which were often very, very hard for most patients. So I like the fact that the Utah looks at the increase in symptoms. It's really looking at pacing and monitoring throughout the protocol for any flare-ups. So it's a great tool. But even the Utah protocol says that for anyone with post-exertional malaise or ME/CFS, it may not be the right starting point. And they very clearly said that in the protocol as well, that you have to start with stabilizing the system with pacing, fatigue management, things like that. And only when you can do exercise to a certain level, you can consider adding this. However, again, Utah is a progressive protocol, and progressive exercise doesn't often do well for those with ME/CFS. So I don't personally use it for those with ME/CFS, but for those with POTS without ME/CFS, it's a great tool.
Can wearable technology like heart rate monitors or smartwatches help people to self manage their POTS symptoms?
I think there is value to wearable technology, especially heart rate variability can be a great cue for the state in which your nervous system is. So, for those who don't know, heart rate variability is basically a tool that gives you information on your autonomic nervous system. So, when you're in a heightened sympathetic drive, the HRV drops. When you're in a more stable parasympathetic rest and digest state, the HRV increases. So looking at those numbers, there are some real-time HRV devices, apps like Visible take an HRV score and give you a readiness score. Things like that can be helpful to manage your day-to-day activities. Having said that, we need to have some healthy boundaries with them. Number one is that often the app will give a great score, but the individual may not be feeling great, in which case we always listen to our body. So these scores are like the weather forecast, like they are telling you what the weather can be for the day, but they're not always accurate. So we listen to our body always, that always takes priority. For some individuals, it can be very triggering to look at those numbers. It can create a lot of anxiety because they're worrying that they're not within the right level that they should be. And if it's increasing their sympathetic drive, it's counterproductive because we don't want that. We want to calm that drive down. So in those cases, I would not use wearables. I would use other tools like RPE, rate of perceived exertion scale. Now, one place where I use the heart rate a lot is for exercise, if I do incorporate exercise or movement for those with ME/CFS. So the recommendation is to be within 15 to 20 beats per minute above resting heart rate to be within that anaerobic threshold. So that's the general guideline. So I usually will start some movements in recumbent and always make sure that we're under the 15 to 20 range to make sure that we're not crossing that anaerobic threshold.
What should caregivers, family, or friends understand about supporting someone with POTS?
Lovely. That's such a nice question because that's and a very important question too. So number one, I would say that POTS is very, very real. Just because it has invisible symptoms doesn't make it any less debilitating. It's a very real condition. very overwhelming for the person navigating it. Second thing that I often see caregivers find it hard to grasp is the variability. So one day the individual may be very chatty and active, and the other day they may need long hours of rest in bed. And what I do want to say is that that is the nature of this illness. It looks different every day. The day-to-day variability is common. We definitely want to use tools to stabilize that, but there'll always be some variability. No 2 days look the same. And really, I think the heart of caregiving is communication, right? Like, what are tools that help you? What are the ways I can support you? What ways the individual is seeking support? Really communicating with them about that. What areas of their care do they want more autonomy over? Because we do want to, respect them. We do want to respect their dignity. So I think communication fosters a healthy collaboration between the individual impacted as well as the supporting family members, and helps us develop a better positive relationship between them long term. And
Absolutely.
one other thing I do want to say specific to POTS is the safety element. So often when the cerebral blood flow or the blood flow to the brain significantly drops, I do teach caregivers and family members to be able to recognize that. So if the individual is dissociating, they're looking like they're going to faint, they're getting very dizzy, they're not responding to you well, then we must help, but we must be able to help them lie down safely and support them with sodium, with fluid, and really be calm and present in that situation. Though that can be very important from a safety perspective with POTS.
Good point. If someone suspects that they may have POTS, who should they talk to for diagnosis or support?
Right. So I think, as I said, sometimes we have to wear on the detective cap. So what I suggest is that at least for a week, note down symptoms and the patterns of those symptoms. So when those symptoms come on, what triggers it, what relieves it, sort of maintain maybe a 1 week journal of your symptoms. If you do have access to a heart rate monitor or a blood pressure device, then doing that active 10-minute stand test at home, at least for 3 days, and logging those numbers can be helpful. So we collect all this data like a detective, and then we go to our family care providers and show them. Family care providers are a good starting point because obviously they're going to navigate care from there. If your family care provider is not very informed on POTS, then advocacy groups like the Dysautonomia International have some very good resources on this. So printing that out and taking that to your appointment can be helpful. And if they are still honestly dismissive and not paying attention to it, I always say trust your gut. You know your body better than anyone does. And in that case, trying to seek support maybe with a physio like me who's informed in this, or looking at the website of Dysautonomia International and seeing what providers in your area are informed on this condition can be helpful. We need to find specialists who get it, but it's very important to believe yourself first.
Absolutely. Where can someone find you if they want to learn more?
So I work in Vancouver, and I basically work at the Canadian Pain and Regenerative Institute. They have a branch both in Vancouver and New Westminster, and I work at both the places. So you are welcome to come see me there. I also have now a monthly newsletter, and the intention of it is to be able to provide educational resources, share new literature, any new program offerings with anyone in the community who needs support. So that is open to both my patients and also people who are not working with me. It's really just for us to build a little bit of a community and learn together. So if anyone wants to join that, then I'll give you my link tree. You can maybe put it in the podcast description, and that has a link for joining my newsletter, and you're welcome to join me there. The link tree will also have my email as well as the links to my clinics. So there are many ways to reach me.
Well, thank you so much for speaking with me today and sharing your knowledge about POTS. I know it will help people listening out there who may not know that they have it and those who need strategies for managing life with this condition. Thank you.
Thank you so much for having me. It was wonderful chatting with you.
This was the final episode of Season 2. Thank you for listening, and make sure to keep in touch. I'm on Instagram, TikTok, X, and Blue Sky, and I appreciate the follows and hearing your feedback. I hope to hear from you soon. Until then, stay safe and stay informed.